Hi, my name is Yasmin Arancibia. I'll be doing my research speech on eating disorders in minors. Here are my notes. Here are my audience. The beginning of anorexia is like heroin. These are the words of Suzanne Burton in her memoir, Empty. She described her struggles with anorexia and binge eating disorder throughout her early and late teenage years. A study in 2023 by JMA Pediatrics on global proportions of disordered eating in children observed over 6,000 adolescents, and of those 6,000, they found that 22% had disordered eating. That is 1 in every 4 kids. Today, I'll be shining light on eating disorders in minors by explaining the different kinds of eating disorders, the role parents play, and the treatments available. First, I want to bring your attention to the different types of eating disorders. The first one we'll be looking at is anorexia nervosa. This is characterized by abnormally low body weight and an intense fear and disordered perception of gaining weight. And some symptoms of anorexia is restricted eating and extreme thinness. As mentioned by Don Nardo in his book, Teens and Eating Disorders, some symptoms that can develop over time is anemia, low blood pressure, severe constipation, and the thinning of the bones, also known as osteoporosis. The next one we'll examine is bulimia. This is recurrent episodes of eating large quantities of food, also known as binging, and shortly after, trying to use unhealthy forms of releasing what was just consumed, such as vomiting or the use of laxatives. And symptoms of bulimia are sore throat, the wearing of teeth enamel due to the vomiting, and intestinal distress from laxatives. The final disorder we'll discuss is binge eating. And this involves feelings of being unable to stop consuming foods, usually within one sitting. Some symptoms of binge eating is eating very fast and until uncomfortably full, feelings of disgust, and often eating in secret or alone. Now that we've touched base on the 3 main eating disorders, I'd like to talk on the role that parents play in disordered eating. BMC Public Health published a study conducted in 2021 on parental appearance teasing in adolescents and the association it had with eating disorders. And the results showed that the influence and impact of parental teasing remained significant. A study focusing on childhood and parental bonding and the relations it had to eating disorders found that patients with eating disorders had higher levels of trauma. They also discovered those that had perceptions of their parents being too controlling or unaffectionate correlated with patients diagnosed with eating disorders. About 22% of children get help on their eating disorder. So what can a parent or guardian do if they are seeing a rise in similar symptoms within their own child or teen? Seek treatment. One of the options available is nutritional counseling. And this is a set plan and schedule of the foods that the child or teen should consume. Allowing a professional to step in can be helpful to make sure that they are actively working with and understanding the limits of that minor. Psychotherapy is another available option, and this could be a family-based therapy. Information within the eatingdisorderhelp.com website explains the Maudsley approach, which involves family meals with a therapist who helps recognize that family dynamic surrounding meal times. This kind of treatment is usually available through an eating disorder treatment program. And finally, there's medication. There's a few FDA-approved medications that can help with eating disorders. And some of these medications are the same ones that assist with other co-occurring illnesses, such as anxiety and depression. So as we've discussed today, parents play a critical role in both treating and assisting in the development of an eating disorder. While there are other challenges parents face that weren't discussed, such as denial, social pressure, and media influence, recognizing the signs and taking action is significant to help children overcome this disorder. Through awareness, parental support, and through treatment, recovery is possible. Thank you.
Completo.
Here are my 6 audience.